The manual version of the Hoyer lift has a hydraulic cylinder and hand pump with a weight capacity of 400 pounds. It comes with various sized U-slings to fit patients of different heights. Remember to take off footrests and lock the wheels on the wheelchair prior to the transfer. Explain the lifting sequence to the patient before attempting to lift them the first time. If in a hospital bed, raise the level of the bed to the highest position before moving the patient onto the sling. When the patient is ready to be lifted, lower the side rail and level of the bed, decreasing the distance the patient has to be elevated. The sling should support the person's head, midsection, and buttocks. As you can see, Stephen would need a much larger sling. To position the sling correctly, roll the patient to his or her side first and ensure that the top of the commode aperture or U-shape is at the base of the spine. Bring the leg support straps up and around the thigh, then cross them between the legs to provide greater security and prevent the patient from sliding out of the sling. Roll the base as far into the bed as possible, locating the cradle over the patient. Turn the knob to lower the cradle. Be careful not to lower the frame onto the patient. Use the parking brakes to stabilize the lift. Do not attempt to lift the patient with the mast assembly swiveled to either side. The patient's weight must be centered over the base legs at all times. The sling has loops that are color-coded so that it's easy to keep straps of equal length on each side. Attach the shortest possible loops. When both sides of the sling are attached to their respective sides of the cradle, raise the patient slowly. Unlock the wheels and use the foot pedal to widen the base and maximize stability. Carefully move the lift and position the patient above the wheelchair. Lock the lift and slowly lower the patient into the wheelchair. Once the patient has been lowered, maneuver the cradle handle to avoid contact with the client. Then remove the sling from the frame. Lastly, cautiously remove the sling from the patient to preserve skin integrity and provide maximum amount of comfort for the patient.